On behalf of the Engelberg Center for Healthcare Reform at Brookings, welcome to today's event. We're delighted to see so much interest so early in the morning as we discuss healthcare reform headed into 2009. That includes a discussion of the policy, the public opinion issues, and the politics. And as you can see from today's agenda, we're putting a special emphasis on changing the way that healthcare is delivered, doing a fundamentally better job. Well, we've got a diverse set of participants here today to help us do this. That includes leaders from Congress, past and present leaders in the executive branch, as well as congressional and HHS staff experts and people from health plans, providers, the business community, academic researchers, consumer perspectives, and many others. And I want to thank all of you for taking time out of your busy schedule to participate today. I also want to recognize some people who have helped make possible this event and all of our work at the Engelberg Center at Brookings. And Strobe alluded to this in his remarks as well. First, Al Engelberg, who is the founding donor for the center and a Brookings Institution trustee. It's very nice to have Al here. We had discussions about this going back a couple of years now, and it's nice to see what it's turned into. And I'm also very glad to have Al's wife, Gail, joining us this morning as well. And I also want to recognize Leonard Schaefer, another initial donor and sponsor of the Leonard Schaefer Chair in Health Policy Studies and a Brookings Institution trustee as well. Al and Leonard made it possible to get this center off the ground last year and launch much of the work that is underway today. Since that time, just a little over a year ago, we've added more than 24 researchers and staff and scholars and formed partnerships with academic organizations and the private sector to fulfill our goal of being a do tank, conducting new analysis, but also providing the technical support and coordinating role to translate promising new policy ideas into practice. This wouldn't have been possible without Al and Leonard's strong support for our efforts to achieve healthcare reform from the start of this organization. Our work also reflects the support of many other people who have been instrumental in Brookings activities. So I want to again thank the Brookings trustees who are here with us today. We very much appreciate their leadership and support. And finally, I want to recognize the experts who are participating in this event. Many of them are collaborating with the Engelberg Center and its analysts in one capacity or another. And I'm going to highlight some of those activities as we go along. It's great to see all of them together this morning, and it's, I think, a reflection of their commitment to make urgently needed progress on healthcare reform. So we're here today to take those steps, to address some key questions about the challenge of reforming our nation's healthcare system. There is more urgency for action on reforming healthcare than ever. On the one hand, the economic downturn is creating bigger problems than ever in making healthcare affordable. And on the other hand, many new treatments are coming along that hold the promise for more personalized and preventive and effective health care. There is also a tremendous opportunity as we transition to a new administration and a new Congress, so it's the right time to bring us all together. One theme of today's event is that it will be hard to achieve reform without improving both coverage and how health care works. Since we can't afford simply to try to buy more people into our existing health care, we need to get more people into coverage while also getting more for the money. And the speakers today are going to address key aspects of this issue. At the start, to kick all of this off, we're going to hear about the outlook on health care reform from Senator Max Baucus, who has a critical leadership role to play in this process. And at the end, we'll also hear some bipartisan reflections from Senator Burr and Senator Whitehouse, who are both committed to achieving broad-based effective reform. In between, we're going to have some lively discussion on 3 panels. The first will be about improving the way that healthcare works. We'll get some perspectives on how it can be done, how it is being done, real health care reform, not what happens just in Washington, but what happens when people actually get health care around the country. Improvements are taking place, but often they're isolated, and it's a challenging process. Why is this so hard, and what's standing in the way of these approaches to deliver better care at a lower cost? What's standing in the way of their becoming more widespread? Second, our second panel is going to deal with what can happen here in Washington and in state capitals and in other policy efforts around the country to improve the quality of care and reduce its costs. What healthcare policy reforms can achieve both improvements in coverage and in access as part of reforming healthcare financing and coverage. I wouldn't be surprised, given the perspectives that we have on both of these panels, if the two topics blended together a bit. Then the third panel is going to deal with the most important perspective on action for real health care reform, and that's what Americans think and support. How is the public viewing health care reform? And with that in mind, how will they view efforts like you're going to hear about today to try to make health care work better as part of reform? Are there better ways to engage the public to improve the outlook for health care reform? What you will get today is a lot of back and forth, some frank discussion and interaction among the moderators and the panelists, and hopefully involving many of you as well. What you won't get today is a bunch of formal presentations and papers. There are plenty of those around. We have added a couple. First of all, there's a background white paper on health care reform being released by the Center today, setting the stage for real health care reform in 2009. It provides an overview of some of the reasons that reform is on the front burner in the policy and political agenda now. It reviews some of the evidence on effective ways to reform how care is delivered, and some of the policy ideas have been put forward to support getting better care and lower costs as part of an overall health care reform strategy. This draws on the work of many of today's participants and some of you in the audience as well. We're also releasing a shorter document on priorities for reform that's included in your packets as well. This paper highlights some of the key reform issues and strategies from an action-oriented perspective, with an emphasis on some of the activities taking place right now at the Engelberg Center. So please use these and other papers for background. Today, we're taking all that background for granted and challenging our participants on how to move forward. Now, before we get started, just a couple of final housekeeping points. We do have some press in attendance despite the early hour, and also this event is being videotaped and will be available on the Brookings website soon, so everything here is on the record. And we've got a lot of ground to cover, so I'd like to remind the presenters and the members of the audience to keep their remarks and questions brief so we can keep as much time as possible for discussion. And that brings me to a very special privilege, and that's the opportunity to introduce our lead-off speaker today. Senator Max Baucus has dedicated his life to serving the people of Montana and the United States. He just got reelected by a wide margin. Congratulations. Something I expect that all of you know is that Senator Baucus is chairman of the influential U.S. Senate Finance Committee. In this job, he plays a critical role on issues related to taxation and tax cuts, to the future of Social Security, to trade issues facing the nation, and, of course, to health care reform. His committee and his leadership will be critical to health care reform efforts in 2009, and he has made clear that health care reform is his #1 priority, including tax and financing reform and steps to promote reforms in the health care delivery system. He views it as part and parcel of dealing with the severe economic challenges facing the nation. To back this up, he just released a unique, comprehensive paper on health care reform, a call to action in 2009, laying out some key elements that could form a foundation for building broad support for achieving health care reform next year. And he's following that up with a Senate Finance Committee hearing on Wednesday. Having worked with him on Medicare and many other issues, I know he has a real passion to make this happen. He's putting the groundwork in place to move it all forward. Something I expect that most of you don't know about Senator Baucus is that he has that truly special kind of stamina that it takes to see through such a major reform effort. As I understand it, after you get health care reform launched this week, Senator, you're planning on doing a 50-mile run this coming weekend. Is that correct? So there you go. That's the kind of stamina that we need to lead these efforts. Senator Baucus, please join us up on the podium. Thank you.
Thank you, Mark, very, very much. Either stamina or foolishness, I'm not sure which. But thank you for that very kind introduction. Many of you know I've known Mark for a long time, and a lot of you have known Mark for a long time and know what a great person that he is, and very talented and so dedicated to public service. And thank you, Strobe, too, for all of your service to our country. I've known of you, watched you, read articles by you often, and I'm always very impressed with what you have to contribute. Thank you very much. I want to also thank and recognize Chris Jennings. I don't know if Chris is here in the audience. Chris is another person who's been very involved in health care reform, as many of you know, in various capacities. And I don't see Chris here, but I do want to compliment Chris for all of his work. The 19th century British philosopher Herbert Spencer wrote, "The preservation of health is a duty." Well, the duty in this instance is that of Congress. It is the duty of the next Congress to write meaningful health care legislation that provides coverage for all Americans. We have a duty to address the underlying problems in our health system. We have a duty to enact it in law this year. The time is ripe. The moral imperative has never been stronger. At this moment, 46 million Americans have no health insurance. 25 million Americans have some insurance, but it's lousy insurance. A big illness can sink them financially. Healthcare spending and medical bills play a role in half household bankruptcy cases in America. Half of the household bankruptcies in our country are medical bill related. Healthcare costs are out of control. Between 2000 and 2007, healthcare premiums in my state of Montana increased by almost 89%, and that's 5.5 times faster than wages. And that's just premium cost. It's not out-of-pocket cost, which makes that proportion even worse. It's not just cost to families that matter. Our businesses are struggling, and federal health care programs are consuming a larger share of the budget each year. The health care system is broken for individual Americans, and it's straining our economy as well. Moreover, whether you have insurance or not, and regardless of how much you spend, there's no guarantee you'll get good quality care. Americans get the best recommended care only half the time. We rank 19th out of 19 countries in preventable deaths. Without reform, none of these problems will get solved. For all these reasons, last week I released a call to action which aims to do 3 things. Get everyone in America covered with decent health insurance. That's everyone in America. Second, reduce health care costs so that everyone can afford the care they need, even if their insurance is pretty basic. And third, make America healthier with better quality care and more preventive care. The plan will cover the uninsured by strengthening the employer-based system, by targeted expansions in public programs, and by creating a new arrangement, the health insurance exchange, where individuals and small businesses can go to get affordable coverage. The plan calls for everyone to have health coverage, everyone, an individual responsibility, and a responsibility for employers to provide coverage or contribute toward covering the uninsured. We all are in this together, and so everyone is expected to be part of the system. This notion of shared responsibility is also why the plan calls for significant progress in reforming our health care delivery system. Providers need to carry their weight also, and by that I mean they have a responsibility to improve the quality of the care they provide. My plan would improve quality by strengthening the primary care system. Primary care providers, including community health centers, watch over a patient's whole medical history and keep them healthier all of their lives. Yet our current system undervalues this critically important work, leading to a shortage of primary care physicians. The call to action rewards primary care by increasing reimbursement for primary care services, providing additional payments for primary care doctors to improve care coordination, and encouraging more medical students to choose a career in primary care through placing more value on primary care work. The plan also proposes to pay providers for the quality of the care they give patients. Today's system pays doctors, hospitals, and other providers based on the amount of care they deliver, not for the quality of care that patients receive. The call to action takes important steps toward putting it in the financial best interest of providers to do everything possible to improve quality. How? By establishing a pay-for-performance program in Medicare that will reward hospitals and provide the highest quality care. Next, creating new policies that penalize hospitals with high readmission rates. And next, testing models to bundle or combine hospital and physician payments in an effort to encourage them to work together to provide quality care and reduce costs. Finally, the call to action invests in new tools for providers. In order for providers to reorient themselves toward improving quality, they need tools to make evidence-based decisions. To this end, the call to action invests in, first, comparative effectiveness research that will give providers unbiased and actionable information about what treatments, what technologies, and what procedures work best for patients. In addition, health IT that will reduce medical errors immediately and over time allow providers to share patient information and connect with colleagues to more effectively manage care. These elements of the proposal are essential. In my view, delivery system reform is not only integral to health care reform, but it is essential. Each of the key challenges facing our health care system, lack of access to care, the cost of care, the need for better quality care, must be addressed in concert. Covering millions of uninsured through a broken health system will be financially unsustainable. Attempting to address the inefficiencies plaguing our system and the perverse incentives in the delivery system without covering the uninsured will fail to alleviate the burden of uncompensated care and cost shifting. The time for incremental improvements has passed. Health care reform must be comprehensive in scope. Now, you're wondering how we move forward to get this done. Obviously, moving this legislation will require collaboration, working with the new administration and with the HELP Committee, with many colleagues, Democrats and Republicans, Senate and House members. All together, we must work together. I often believe that nothing of consequence ever gets accomplished without teamwork, without collaboration. That is certainly true here. In fact, I'm meeting with HELP leaders, that is the HELP Committee leaders, and Senator Grassley tomorrow. The Finance Committee has spent a good deal of time in preparation for this debate. We've held lots of hearings. We have another one scheduled Wednesday about health care and the economy. Let me be clear. There's no way to really solve America's economic troubles without fixing the health care system as well. If you fix Wall Street, you fix the housing crisis, you change taxes, you do fix everything else, and you don't fix health care, then government spending will keep going up. Health care costs suck up more than 16% of our economy, and they're growing. Deficits will continue to rise, and America will just have more economic troubles down the road if we don't fix our health care system. And our businesses will keep struggling to compete here at home and around the world. If we're going to have a 21st century economy on a 21st century playing field for American innovators and entrepreneurs and workers, then we'd better get a 21st century health care system now. That's the focus of our committee's hearing tomorrow. I'm going to need your help. I need your support to make the changes needed to make the system work better. The research you're already doing is very helpful. Your work is directly related to some of the reforms I envisioned and call to action. But I also need all of you here to help me create a can-do environment for health care reform. And I'm asking you to evaluate every proposal based on whether it will make the system work better, not worse. It will take a lot of us working together with open minds. But I believe we can do it. Taking incremental steps in the face of so many challenges no longer makes sense. And I believe the policy ideas and the call to action are the right way to start. In fact, here it is right here, a little booklet. And frankly, I'm very, very proud of this. With all respect to the great academic expertise at Brookings, I must say that I think this is probably going to be close to the Bible that everyone's going to look at in trying to figure out what our health care reform changes should be. I see Secretary Shalala here sitting in the front row. I want to thank her very much for all that she's done. Our lead-off hearing, we've had 12 hearings this year on health care reform, and she was in our lead-off hearing, and just want to thank you, Donna, so much for your wonderful contribution. But anyway, we're off and running. And I'm making this, as Mark said, my top priority for the year. It's got to be done. It's going to be extremely complicated, but I've never felt such a sense of teamwork already. Providers, insurance companies, pharmaceutical industry, medical equipment manufacturers, everybody knows we've got to do something, and I do believe that time is ripe. In fact, I just got a call from President-elect Obama just a couple of days ago. I was home in Montana, a little plane landed, a cell phone rang. It said private number, so I pushed it. I said, hello. And the person on the other end said, Max, this is Barack. And so we talked about health care reform and what we need to do to get health reform passed. Now's the time we're going to get it done. So thank you, everybody, very, very much.
Thank you, Senator. Now, Senator Baucus has got time to stay for just a couple of questions. So if any of you in the audience have anything you want to ask about this bold agenda he's laid out, now's the time to do it.
Senator, are you going to start by drafting a bill to work off of? What's your process?
Yeah, we put together basic concepts in the paper, the white paper. Now we've got to start getting some cost estimates, figure out what different components cost. That takes legislation so that CBO can score it. There'll be some back and forth with CBO, I think, before I introduce the bill. But I'm also, as I indicated, meeting with Senator Kennedy this week, and Senator Grassley and others as we work together. I don't know if it'll be one bill or whatnot, but I do know that we need to get scores, and to get scores, you have to have legislation. But again, we'll be working with CBO to get those scores and figure out, dot some I's and cross some T's. Having said that, though, I very much meant it when I said I want to work with all the committees. I mean that. When I talked to Senator Clinton about health care reform a short while ago, she said one of the mistakes they made was that it was a little more top-down administration, and committees got to work better together, and also a lot of this must originate in the Congress. We're going to get this done. This can take work, but I just feel the time is ripe, and I'm very excited about it. I'm going around talking to a lot of senators, Republicans and Democrats, asking them what they want, what makes sense to them, encouraging everybody to suspend judgment. If for only a nanosecond, suspend judgment. Let's just keep an open mind about all these different components. And there's some things Republicans traditionally don't like, some things Democrats traditionally don't like, but heck, let's keep an open mind about this and see how we can fit some of this together. My goal is implied, it's bipartisan. We may have to get partisan. I very much hope not. My first goal is to make sure we work together.
Yeah, Jim.
Larry. Consumer Reports. I think you're right that this can't just be top-down. It's got to be. Jim Guest from Consumer Reports. It's got to be bottom-up as well as top-down. And wondering if you've got thoughts about how to mobilize public support, how to mobilize consumers around your proposals, because that's going to be an element that I think was missing last time. That's going to be crucial now. And by the way, Mark, I might just say, back in the 1960s, we were both staff members here in Washington. He was a hell of a touch football player.
Oh, thank you. That was fun back then. Thank you. We're working with the various groups to mobilize support. SEIU and Divide We Fail and all of the other organizations that are very much interested in health care reform. But you're absolutely right. It's the approach we took, frankly, this would be stepping some toes in this room, I think not very many, and stopping the president's effort to privatize Social Security. I and my chief of staff are working with lots of outside groups, spent a lot of time making sure that not just Congress, but the outside groups are working in concert with what we were doing. I've lost him now. He's gone to President Obama, but we're still working together.
I think we have time for one more. Larry Minix.
Senator, does your plan include long-term and chronic care?
Yes, it does. Absolutely. Absolutely. Our incentives for chronic care to address the problems that chronic care costs. I've forgotten the exact figure, but it's what 30-40% health care costs are chronic care related. And it gets to the reimbursement system for primary care physicians, for bundling, for medical home, the concept of medical home, to address the excessive chronic care costs and prevention so that doctors are seeing patients earlier. And also we have written into this something, I forgot what it's called, the right card, something like that, right choice provision, so that people who are uninsured, for whatever reason, can go to a community health center or provider for 2 years. It's a demonstration kind of a project to get screened, and then to potentially head off some of the chronic care problems they may have, and then also to address the chronic care conditions, if it's diabetes or heart failure, whatever it is that they may have. Chronic care is a huge, big problem that we're trying to address here.
What about the long-term care component?
Long-term care is not included in this. It's all care in America, but basically, except for long-term and also not military. We don't have VA included in this or TRICARE, military care. That's just maybe down the road we'll be able to include some of that, but right now we don't have that. I addressed Indian Health Service, though. That's a big problem in America, huge problem. I'm excited about this. We're going to make this happen. It's going to work.
Senator, thank you
and
very much.
I see Senator Whitehouse, who's a really strong advocate of health care reform, too, and he's part of the team. I want to have Liz Fowler stand up. Liz Fowler is the head of my health care team. She and her team wrote this paper, and they are really good.